all know there's often still some stigma attached to even discussing mental health concerns. Now, more than 60 local business leaders are working to change that by making mental health care a priority for their employees. It's called CEOs Against Stigma. And Connecting Point correspondent Carolee McGrath learned more when she spoke with Bernice Drumheller, president of the National Alliance on Mental Illness, Western Massachusetts chapter, and Joanne Marcuzzi, president and CEO of Cooley Dickinson Hospital in Northampton.
Research shows that mental illness, particularly depression, is the #1 leading cause of disability in the workplace. Stigma is a negative stereotype of the cause and effects of mental illness. Therefore, causes barriers to treatment.
Joanne, I'd like to ask you, why did you think this was an important campaign to get behind?
So as a healthcare provider, we focus a lot on stigma and mental health issues for our patients. And we actually had been doing a lot of work to try to help our employees make sure that their biases and all the stigma that's in the society didn't affect how we care for mental health patients. But as an employer, I don't think we focused on it as much. And in healthcare in particular, our employees often don't think of taking care of themselves. They went into healthcare because they want to take care of others, and it's almost as if that's not consistent with why they're there. They're supposed to care about the patient, not themselves. But obviously, to care for patients, you have to feel healthy about yourself and be able to work well with others. So when we heard about the campaign, we were really excited because we felt like it was a way to translate our basic beliefs and passions about the importance of mental health services and anti-stigma from the patient perspective and the caregiver perspective to us as an employer. We have about 1,900 employees, and it's really resonated with the staff.
But how do you do it? Because whether we like to admit this or not, there is that stigma. So if I'm an employee and I'm struggling with something, let's say it's depression, I'm probably not going to want to share that with a number of different coworkers. And then how do you go to your boss and say, you know, I just can't get this done today because I'm having this issue? How do you do that? And then what do you say to that person?
So it's obviously not some easy solution.
No.
A campaign to change how people think is probably the hardest kind of campaign. But I think NAMI's done a really good job at putting together something more robust and more meaningful than just some advertising that says don't
Right.
stigmatize. So there's a lot of ways we do it. First of all, we encourage people and we make sure they know about the employee assistance programs, which are totally confidential. We've also done training, we'll continue to do training with our managers for them to be able to identify when there might be a problem and how to raise it with their staff person in a way that's respectful and that's just showing that they want to help.
Can't that get you into trouble a little bit too, though? I mean, if you kind of see that somebody might be struggling, but you say something, you know, that could get you into, I guess, hot water.
Say, is there something we can do to help? Would you like to go talk to employee assistants? Do you need any flexibility with your hours, which you would ask if somebody had a physical illness, right? But it is so ingrained in us to think about it differently. And then, you know, tell them that we want them to seek help, and the worst thing would be if they don't seek help. We did a great session that NAMI organized called In Our Own Voice, which had both videotapes of about 8 or 9 patients, 8 or 9 people who are living with mental health issues, as well as 2 people who came and spoke to us live and gave us their story. And these are people who you would never have thought. You know, they're in the workforce, and they talked about what it was like when they first tried to talk to their employer, or they tried to have some flexibility around being able to leave to go to their therapist, and how much worse it was because they didn't feel that support, and how it made something that was already so challenging that much more difficult. So, you know, it's just by talking about it, you destigmatize it, by showing that there are people who look just like you and me out there with mental health issues, and the fact that you can get treatment and get better and try to
and be productive
and you know the statistics. I mean, at our management meeting earlier this month, we had a whole presentation on it again to help our managers understand it. And I asked people, how many of you have ever, and so this is about 80 or so employees, managers at the healthcare system. I asked, how many of you have ever had surgery? And actually an incredible number raised their hand, but it didn't even occur to them. And then I said, how many of you have sought therapy for mental health? And I said, I'm kidding. I'm not really asking you to raise your hands, but that feeling they had. And so why is that? Why can't we feel as comfortable saying, yes, I've gone through depression and I'm getting it treated, and because hiding it just makes it worse.
Bernice, how did you become involved in this?
Well, first of all, I had my own mental health challenge with depression, with postpartum depression after my fourth child was born. That's part of it. And then I have a son who has schizoaffective disorder. And NAMI was very supportive. I received a lot of support from my workplace, actually, several years ago, before this CEO Stigma Against campaign came into play. But I understand the value, the true value of, because I was left supporting 4 children and a house, and I know how important it is to be able to talk to your employer, especially if you have to run out because your son is having a mental health crisis. So this is extremely important. And I think that the CEO campaign aims to overcome silence and isolation by guaranteeing a positive and effective environment for everyone in the workplace.
Joanne, I do have to ask you, as a CEO, you have a very difficult job of balancing both, I guess, the health and well-being of your employees, but also understanding that if somebody is struggling with something, you have to worry about the employees that are surrounding that person. How do you balance that, making sure that the health care of everybody in that office is okay?
I think the way is to make sure that people feel comfortable coming forward and talking about it. It doesn't mean they have to share it with their entire department, but that they can get help, they can take the time off, and not continue to try to work beyond what they're able to do, or that they can continue to work because they're getting their services. But we would be naive to think that there aren't people at every hospital around the country who are struggling with mental health issues, just like we have employees who are struggling with cancer or with rheumatoid arthritis. And the issue is, if they can get care and know that they can go to their supervisor to say, can I have some flexibility, just like you would if you were going through a physical medical issue, then I think people can continue to be really productive.
Okay. Joanne and Bernice, thank you so much for coming in and talking about this very important topic.
Thank you for having us.